Hello, my name's Dr Sherina Fernandes. I'm one of the lead GPs at Doctor Care Anywhere, and I'm also a lifestyle physician with Renew Lifestyle. And I'm going to be talking to you today about sleep. So sleep is an important topic. And why am I qualified to talk about sleep? Well, I mentioned that I'm a lifestyle physician. So I thought I would just mention first what lifestyle medicine is. So it's a really sort of emerging field in medicine, evidence-based, and it focuses on 6 pillars of health. So I've listed them here, but these 6 pillars involve things including a healthy diet, movement and exercise, avoidance of risky substances, stress management and social connectedness, and then finally sleep. Sleep is a really important pillar that's often neglected and forgotten about. So I'm going to talk to you today about why it's so important. So if we're talking about sleep, first thing, who has children? Anybody that has children probably values their sleep. Particularly when you first have a baby, you suddenly realise how important sleep is. This here is my son Noah. It may not look like it from this picture, but Noah barely slept for the first 2 years of his life. And that had a profound effect on myself and my husband when I look back on things. So if any of you are parents, you may be appreciating having a listen to this talk. What I'm going to be doing is talking about why sleep is important, what happens when we sleep, if we don't sleep. I'm going to talk to you a little bit about what happens in the body and our natural body clocks to make us sleep and our sleep drive, and then some things that we can put into place to help us sleep. So why is sleep so important? Well, we spend 1/3 of our lives sleeping, and everybody needs a good 7 to 9 hours of sleep per night. So it's really important as well that this quality is quality sleep. So it's good quality sleep and it's not just the duration. And I'm going to speak about what happens when we sleep. So when we sleep, our metabolic demand decreases as we need less energy. We're not moving anymore. So the body can use this energy to restore and repair. During sleep, we have lots of things going on. So first of all, DNA remodeling and repair. We get secretion of anti-cancer cytokines. If there's anybody medical here, that's things like interleukin-1, interleukin-2 and TNF-alpha. These are really important in cancer prevention, which I'll come to later. When we sleep, we shift into our parasympathetic drive. So if any of you have heard of the fight or flight reflex, and we talk about the sympathetic nervous system when we're stressed. When we sleep, we get the parasympathetic drive. We have less stress hormones. They decrease significantly. So hormones such as cortisol will go down and you get better insulin sensitivity and less sugar in the blood. So this is important if there is any family history of diabetes or if you're at risk of diabetes yourself. So for those at risk of type 2 diabetes, a study has shown that there's an increased rate of type 2 diabetes in those who sleep less than 6 hours per night, and that's even for adjusting for body weight, age, smoking and race. In healthy subjects, another study who was subjected to 1 week of less than 6 hours sleep, what they found was at the end of that week, they were 40% less effective at absorbing a standard rate of glucose compared to when they're fully rested. So you can see the implications this has for people with diabetes or prone to diabetes. We also have the hormones leptin and ghrelin. So leptin is a hormone named from the Greek word leptos, which means slender. And what leptin does, it signals to the body to feel full. So it stops you from feeling hungry. So during sleep, you produce leptin. If you're getting good sleep, you have less food-seeking behavior because leptin levels are higher. Conversely, with ghrelin, this is the hunger hormone that drives you to eat. So poor sleep leads to an imbalance between leptin and ghrelin. You end up eating more and your body weight goes up as a result. And I will mention another study here because that's what lifestyle medicine is full of studies. This was a study where healthy men and women, they were sleep deprived in a controlled environment and then they were let loose on a buffet. And what happened, these people, when they were sleep deprived, they were more likely to seek out carbohydrate dense food and an extra 300 more calories in the day. So sleep actually helps you to keep your weight down. It lowers your risk of diabetes. And then if we also talk about cardiovascular benefits, when you sleep, I mentioned about the sympathetic nervous system, the parasympathetic nervous system. So you're reducing your sympathetic tone, which means that your blood pressure and your heart rate go down when you sleep. So healthy sleep reduces your risk of cardiovascular disease and death, and it also has an effect of increasing stamina and recovery time, which is why it's so important for athletes. So other things that happen, we have hormone regulation, protein synthesis, breaking down of fats. And then sleep finally is also doing wonders for your brain. So we have a type of sleep, REM, rapid eye movement sleep, which I'm going to come to. During this sleep, you have enhanced learning and memory storage, you get faster processing and emotional regulation, and better anxiety and fear extinguishment. So what this means is, say you have a traumatic event the following day, if you've had a good night's sleep, you're less likely to get PTSD following that traumatic event. I did mention REM sleep there, so now is a good time to talk about cycles of sleep and the stages of sleep. So at night we cycle through different stages of sleep, and here's this diagram. If anybody owns a Fitbit or an Apple Watch, or even there's a new fancy Oura Ring, you may have seen something like this on your sleep tracker. So what we have here are various stages of sleep. So if I talk through what happens when you first start falling asleep, you go into stage 1 sleep. So this is very light transitional sleep when you're just drifting off. And if you pop something called an EEG, so that's when they pop the electrodes on the head and they watch your brain waves. As you start to go into stage 1 sleep, what you will see on an EEG are waves called theta waves. So waves, it's quite disordered when we're awake, and then you get these slower theta waves. You then progress to stage 2 sleep, which is transitioning between light sleep and deep sleep. So you start to see sleep spindles on an EEG, and these are regular patterns that occur throughout sleep. Then you go to stage 3 and 4, which is deep sleep. So in stage 3, you will see theta and delta waves on the EEG. So you get delta waves now. And by the time you get into stage 4 deep sleep, you will see lovely regular delta waves on the EEG. So these stages, stage 1 to 4, are all non-REM sleep or slow wave sleep. And during this sleep and your deep sleep is when all of your sort of hormonal and restorative processes are taking place. You then go into rapid eye movement, REM sleep. So this is when you're dreaming. This sleep tends to come later in the cycle. And during this period, this is when you get all the emotional processing, learning and memory takes place. And if you look at an EEG here, it's quite chaotic and erratic. And it actually looks like you're awake, because what's happening during REM sleep, your brain is active, but your body is immobilized. And the reason your body is immobilized is you don't want to be acting out any dreams. And again, if you have a sleep tracker, you may notice this yourself, but you get more deep sleep at the start of the night, and the REM sleep tends to be more later on, sort of early morning, later in the night. So going to bed late can actually mean that you're depriving yourself of deep sleep. And in the same way, if you keep getting up very, very early, earlier than you're used to, you might be losing some of your REM sleep. So it's something to bear in mind, and I talk about sort of consistency and regular sleep times later. So I've covered what happens when you sleep, so you can imagine what happens with poor sleep, but I'm going to drive the point home. So we all know that when we don't sleep, the obvious things, we feel grumpy, we're tired, but it does have its long-term consequences as well. So first of all, if I go back to the leptin and ghrelin we spoke of, so not sleeping well, as you can imagine, you're getting increased risk of obesity and type 2 diabetes. Sleep loss actually causes us to produce more endocannabinoids, which are like the drug cannabis. High levels of these stimulate your appetite. So if you're not sleeping, you can actually get the munchies. So lack of sleep, you're going to eat more, and then you're tired and you don't move as much. So you can see how it all builds up. Poor sleep as well leads to increased heart rate and blood pressure, altered fat breakdown, you get higher cholesterol, so you're more at risk of heart attacks, cardiovascular risk goes up, and there's a higher risk of death. And something that Matthew Walker, so there's a book by Matthew Walker called Why We Sleep, which I completely recommend. In there, he mentions a little extract. He says that when the clocks go forward for daylight savings in March in the Northern Hemisphere, the 1 hour of sleep loss that comes with that causes a spike in hospital records of heart attacks the following day. Whereas in autumn, when we gain an hour of sleep opportunity, apparently the rate of heart attacks decreases. It's quite a scary fact. We also, with poor sleep, we're losing the REM sleep, aren't we? So we get impaired learning and memory. We get impaired moral judgment and the misinterpretation of social cues, which is why a lot of businesses now are promoting sleep, and in certain countries they have sleep pods because it can be quite important in a management role to pick up on social cues. We also have decreased alertness, your cognitive processing speed goes down, and there's a correlation of short sleep with depression, bipolar disorder, premenstrual syndrome, and post-traumatic stress disorder, which I kind of mentioned earlier. And then finally, with sleep loss, we're also getting immune system suppression. So I talked before about the anti-cancer cytokines when we get sleep. When we're not sleeping as well, we get more of a cytokine called interleukin 10, which is a cancer stimulating cytokine. We also get disruption of cell cycles and gene transcription. So sleep disruption and short sleep duration has a correlation with certain cancers, which I've put on the slide here. So that's breast cancer, endometrial, colorectal, prostate cancer, and acute myeloid leukemia. And in fact, in Denmark, there was enough evidence that they started paying night shift workers. It was women who had developed breast cancer. They actually got compensation if they were in a government-sponsored job doing prolonged night shifts. So hopefully I've driven the point home about why sleep is important. So now I'm going to explain how we sleep, what's going on in the body, and then go to how we can improve our sleep. First thing to say is we all have an internal body clock. So we talk about the circadian rhythm, and in humans, it's actually very slightly more than 24 hours, but we have entrained ourselves to the 24-hour day. But that's why if you are traveling westwards in the world, it's easier to do this than it is to travel east, and that's because it's easier naturally to stay up later than it is to go to bed earlier. So we have this central body clock. It's called the suprachiasmatic nucleus, and it sits in the brain above our optic chiasm. And what this does, it regulates melatonin secretion, and melatonin is the hormone that helps us to sleep. It helps with our sleep drive. So this varies according to light intensity. When it's light, there is less melatonin, and as light decreases, you produce more melatonin, and this is what makes us sleepy. Blue light actually creates greater melatonin suppression at lower intensities and shorter duration than, say, natural light. So that has consequences, which I'll talk about later. So melatonin secretion does vary according to light intensity and wavelength. So in order for our body to sleep, as well as getting darker, we need our body temperature, our core body temperature, to cool down. Melatonin can help with this too, because what melatonin does, it causes our peripheral vessels, the vessels on the outside of our body, they dilate, so they get bigger, so you get better blood flow there. So our extremities, blood flows to our extremities, so our extremities warm up and our core body temperature cools. And core body temperature cooling is what helps to initiate sleep. And this continues into deep sleep, and then as early morning comes and we're starting to wake up, our core body temperature starts to increase again. And then we have fluid volume. Now this is important. We need adequate fluid volume to help modify our core and peripheral body temperatures. And also what we eat can influence how we sleep. And then finally, with exercise. So when we exercise, we produce a chemical called adenosine, which is important for our sleep drive, which I'm going to come to next. So the more we exercise, the more of this we produce, and that actually helps us to sleep. So I'm going to explain our sleep drive next. So during the day, we get a buildup of this chemical called adenosine, and the longer we stay awake, the more it builds up. And the higher the adenosine levels are, the more sleepy we feel, which is why we can't stay awake forever. That's why we feel so sleepy if we don't go to sleep. When we sleep, we then break down the adenosine, and adenosine levels fall. So looking at this graph here, this is process S, the blue line on the graph. So you can see in the morning, maybe you've just woken up, the longer you stay awake, your adenosine levels rise, and then when you fall asleep, your adenosine levels drop until the next day, and it starts to rise. So that's one process going on, process S. And then process C on the graph here, the red line, is our circadian rhythm. So they talk about a wake drive here on this graph. So as I said before, in the morning, what's happening, you're getting sunshine, you're waking up. Through the day, you're getting more light, peak at midday, we're eating, we are increasing our core body temperature, we're exercising, moving around. And then towards the evening, the light is decreasing, we're slowing down, hence why it's starting to drop down again. Our drive to sleep, the biggest drive to sleep, is going to be the biggest difference between process S and process C, and that is why it's so hard to stay awake sort of in the middle of the night. And I thought I'd keep this graph up to talk about naps here, because naps are brilliant. They're really good for you and they have lots of benefits. As you can probably see, napping is good as long as you get it at the right time of day and the right duration. Perhaps you can see that if you take a nap too late in the day, what's going to happen if you go to sleep late in the day and for too long, you're going to drop your adenosine levels. So when it gets to the evening, there wouldn't be that distance between the two processes, and therefore you will interrupt your sleep. So this is why it's important, if you're going to have a nap, do it earlier in the day and just for a shorter time, not too long. Okay, so hopefully you now understand why we sleep, what's going on. So I'm going to talk about things to help us to sleep. So we are all very, very busy, and modern life is creating havoc with our circadian rhythms, because we've got screens, we've got lighting, and there's night shift work, there's all kinds of things going on. The first thing to remember with sleep is it's really important to have consistency. So there's no such thing as making up for sleep at the weekend. You should try and go to bed at the same time and wake up at the same time each day. I know that can be difficult and there are going to be events, but as a general rule, try and do this. We tend to talk about sleep hygiene when people can't sleep. Sleep hygiene is about having a routine so that you're giving your body signals and cues when it's time to sleep and when it's time to wake up. So having a wind down routine can be important. So I talked about light and what happens with light and melatonin secretion and blue light, etc. So the first thing to think about is screens. So screens emit this blue light. So before bed, if you're in front of a screen, that blue light is going to drop your melatonin levels and potentially stop you from going to sleep. So try and avoid screens at least 1 hour before bed. If you must work, consider some blue light blocking glasses, or at least, use the filters on your screens. The other thing is to think about dimming the lights in the evening, or even considering candlelight if that's an option. And even, sometimes scents, if you're giving your body's cues, if there's a certain scent that makes you sleepy, use that. And then body temperature. So as I said before, we need our core body temperature to drop to initiate sleep. So this is where a warm bath, the favorite thing that I like to do, a warm bath can help. And what happens here, when you get out of that bath, you are going to shift heat from your core to your extremities. And this will help you to go into a deep sleep faster when you do go to bed. In the same way, yoga and even meditation can help, because what they do, they decrease that sympathetic nerve activation and in your muscles and skin. So again, you're getting blood being shunted from the core to the peripheries, so you cool down centrally. That helps with sleep. And also with yoga and meditation, you're decreasing your heart rate and your energy expenditure. So again, it's just letting the body know that we're ready for rest, it's time to sleep. Now, I mentioned exercise earlier. Obviously, if you are active in the day and you're getting exercise in the day, you're going to increase those adenosine levels, and that will help you fall asleep. When I discussed light earlier and I was talking about natural body clock, One thing that can be really helpful is to get some natural light first thing in the morning. So it's better to exercise earlier too. The reason for this is if you exercise just before bed, you're going to end up increasing your core body temperature, and it's going to take you longer to cool down and get to sleep. So if you get out early in the morning, in fact, the light from a cloudy, overcast day is better for your internal body clock than artificial lights inside. So get outside when you can. And remember also, which I forgot to mention earlier, to keep the temperature of the room cool when you're sleeping. So they say 18 to 19 is optimum, which sounds a bit cold. What you don't want is the room too cold, and you want your extremities to still be warm. So if you are struggling to sleep, there are things that can help, particularly if you're very stressed and your mind is active. So we talk about stress reduction and mindfulness to try and help with sleep. So there are all kinds of things available. Something that can be useful is a literal brain dump. So if you're stressed and anxious and there's a lot on your mind, you can start journaling or just put everything physically onto paper and then decide you're going to forget about that till the morning. So it's there, but you can forget about it. There are lots of apps now for sleep, and there are things like sleep stories. There are apps that have music with delta waves. So I talked about the brain waves during deep sleep, the delta waves. So there's music where they mimic those frequencies, and it's supposed to help you sleep. I personally have discovered Yoga Nidra, which is a form of relaxation technique where you're lying completely still and focusing on different parts of the body, which I've found very helpful for sleep. So there's lots of different things out there. But formally, as you've realised now how important sleep is, if you are struggling with insomnia, get help. So the official gold standard treatment now for insomnia is cognitive behavioural therapy for insomnia, CBTI. It's first line, it's in the NICE guidelines, and it's a lot safer than medications. We shouldn't really be giving medications in this day and age. We've moved on. So CBTI uses behavioural methods. So sometimes they do use sleep restriction to try and get you into a routine. They can use stimulus control, relaxation training, sleep hygiene measures, which we've talked about, and cognitive restructuring. So that's what to expect if you're going to have CBTI. So this is a busy slide, and this technically, I've said lifestyle prescription for sleep. This is what a lifestyle prescription would look like. But these are some of the things that may be on a personalized lifestyle prescription for sleep. So it's more just to drive the point home of things you can do to help with sleep. So first of all, having a wind down routine is really important. So whether that's a bath or reading a book or doing some yoga, start about an hour before you go to bed. And with that, you want to get into the habit of having no screens a good hour before you go to bed. Try dimming the lights and keeping your room temperature cool. Don't have anything to eat after dinner, so stop any late night snacks so they don't affect your sleep. You want to avoid caffeine from the evening onward. What caffeine does, it actually blocks your adenosine receptors, so that's why it wakes you up, but it's not good for you and it affects your sleep. In the same way, avoid alcohol within 3 hours of bed. I think Matthew Walker says in his book that if you have to drink in the morning, but I'm not going to advocate that. People who think that having a glass of wine or what have you helps them go to sleep, or they drink a lot and they pass out, what you're having there is not quality sleep. So you're not getting your REM sleep. It's disturbed quality sleep, and I've already told you the consequences of poor quality sleep. You want to increase your daytime exposure to sunlight when you can, increase your physical activity during the day and exercise earlier if you can, and also ensure that you're getting a good daytime fluid intake, because this is actually going to help you with your whole body clock sleep at night. So that is a lot of information to take in, but hopefully you now feel that you know all there is to know about sleep. There's a lot more, but hopefully that helps.